The external genitalia of the male have the structure named as the penis. In this section, we'll be studying in detail about the anatomy. We'll be studying about its multiple parts, the ligaments that are present here, the muscles present in this structure, the skin of the penis, and the vascular supply in detail. So basically, the penis is composed mainly of the spongy tissues, and they become erect due to the blood accumulation in the cylinders, enhanced at the considerable risk. The glands or the head has many nerve endings, which is the two large cavernous bodies, one smaller spongy bodies, and forms the head of the penis. Then comes a structure named as the corpora cavernosa. So corpora cavernosa is, we have two superior masses of the primary erectile tissue, provide majority of the rigidity and length. Posterior expansion forms the two crura, anchor the tissues against the pelvic bone. So we have the two corporas or the erectile tissues, which is the corpora cavernosa, you can see here, and the corpora spongiosum. Now, these are the tissues that are filled with the blood and present throughout the length of the penis. So we have the two superior masses named as the primary erectile tissues. They are going to be providing majority of the rigidity and the length. The posterior expansions are forming the two cruras against the pelvic bone. The other corpora is the corpora spongiosum. It is a mass of erectile tissue and present alongside corpora cavernosa of the penis. This is the corpora spongiosum, and the superior masses are the corpora cavernosa. They are present along with the corpora cavernosum, and both of them are the masses of the erectile tissues, helpful in the erection of the penis, and they are terminating in the glands, which is the head of the penis. The penis has three parts. We have the head, which is the most distal part of the penis, and it is conical in the shape. It is formed by the distal expansion of the corpora spongiosum, and it contains the opening of the urethra, which is termed as the external urethral orifice. Talking about the head, which is also known as the glands, it is the most distal part of the penis. It is conical in the shape and formed by the distal expansion of the corpora spongiosum, present alongside of the corpora cavernosum. It contains the opening of the urethras, which is termed as the external urethral orifice. The other part is the root. Now, root is the most proximal and it is fixed part of the penis. You can see these three parts. We have the root, the body, and the gland. So root is the fixed part. It is the proximal part located in the superficial perineal pouch of the pelvic floor. Now it is not visible externally, and it has three erectile tissues, the two cruras and bulb of the penis. We have two muscles present here, which is the ischiocavernosus and the bulbospongiosus muscle. Talking about the root, what we've studied here, it is the most proximal part, which is the fixed part. It's not visible, so you can say it's not visible externally, and it is located in the superficial perineal pouch of the pelvic floor, and it has three erectile tissues present in it, which has we have the two cruras, and then we have the bulb of the penis. Two muscles are also located here in this root part. Talking about the body of the penis, it is the free part of the penis and located between the root and the glands, suspended from the pubic symphysis. We have the three cylinders of the erectile tissues, which is the two corpora cavernosa and corpus spongiosum. So body is the free part of the penis, which is located in between the root and the glands and suspended from the pubic symphysis. Now it has three cylinders of the erectile tissue. The erectile masses we've studied before, that is the corpora cavernosa and corpus spongiosum, located here. The muscles of the penis are, we have four muscles located in the root of the penis. So the first muscle we have is the bulbospongiosus muscle. We have the pair of these muscles. So the bulbospongiosus muscle associated with the bulb of the penis, it contracts to empty the spongy urethra. It has the interior fibers which are involving mainly in the erection, increases the pressure in the bulb. Then we have this cavernosus muscle, which is surrounding the left and the right cruras of the penis, contracts to force the blood from the cavernous spaces, and blood moves to the corpora cavernosa, and it helps maintain erection. The purpose of these muscles is in the erection purpose. The blood has to be moving into the corpora cavernosa and contracting to this ischiocavernosus when contract and pushing the blood into the corpora cavernosa and surrounding the two both the right and the left crust of the penis. The ligaments we have is the suspensory ligaments that are the condensation of the deep fascia, connects the erectile bodies of the penis to the pubic symphysis. Then the other ligament we have is the fundiform ligament, which is the condensation of abdominal subcutaneous tissue, running down from the linea alba. You can see the linea alba here. They are running down from the linea alba. This is the fundiform ligament, and it is the condensation of abdominal subcutaneous tissue. It surrounds the penis and attaches to the pubic symphysis. Suspensory ligament, the name indicates it's a suspensory ligament, so it has to be causing the suspension or of this penis to the pubic symphysis. But this fundiform ligament, which is basically the condensation of abdominal subcutaneous tissue running down from the linea alba, surrounding the penis and attaches to the pubic symphysis. Now talking about the skin of the penis. Skin is more heavily pigmented than the rest of the body. Connected to the underlying tunica, albuginea. Prepuce, which is the double layer of the skin and the fascia, it covers the glands to the variable extent. Prepuce is basically connected to the skin of the glands by the frenulum, and space between gland and prepuce is known as the perpetual sac. So basically these are the things that are present on the skin of the penis. So it's more pigmented as compared to the rest of the body. It's connected to the underlying tunica, albuginea, which is the covering. We studied this covering in the testes. Then we studied about the prepuce. So what basically it is basically the double layer of the skin. When skin gets double, this area is named as the prepuce, and it is the double layer of skin and fascia. So the fascia is also connected with this region. Now it is covering the head of the penis to variable extent, and this is basically connected to the skin of glands by a structure named as the frenulum. The space between the glands, between the head of the penis and this prepuce, which is the double layer of the skin and fascia, is named as the perpetual sac. Talking about the vascular supply and the innervation. The arterial supply is from the urethral artery. We have the deep artery to the penis and the dorsal artery of the penis. Venous drainage is to drainage via superficial deep dorsal veins of the penis, and the nerve supply is from the sympathetic and parasympathetic for the ejaculation and erection. The purpose of the function of the parasympathetic stimulation is the erection, and the sympathetic stimulation works in opposite to that of parasympathetic functions. Sensory supply to the skin. These nerve supplies are again the sensory supply to the skin. Gland of the penis are from the pudendal nerve. So this glands of the penis is being supplied by the pudendal nerve. Otherwise, it's being supplied by the sympathetic and parasympathetic stimulation for the purpose of the ejaculation and for purpose of the erection. So this was about section 5. Here we've studied in detail about the penis in detail. We've studied about the anatomy, the parts of the structure, the covering of the structure, the ligaments present here, and also the vascular innervation, the blood supply, venous drainage, and the nerve supply in detail. I hope it is really clear to you now. Thank you for watching sqadia.com.